Welcome to Medicare Help Group, a quick guide for your Medicare queries. Let Medicare Help Group assist your needs. Today we will be talking about Medicare Part D costs for 2020. Before, Medicare did not cover prescription medications. There was a limited number of medications that were offered under Medicare Part B, and otherwise, you had to pay for medications out of pocket. But now we have this Medicare Part D, or the prescription drug coverage. Part D plans or prescription drug plans are run by private insurance companies. However, federal government sets guidelines on what basic medications are covered and how much you can charge. A deductible is the amount you spend out of pocket before your prescription drug benefits begin. However, your plan may or may not have a deductible. The maximum deductible a plan can charge for 2020 is set at $435. It has increased by $20 from 2019. So who pays what? So on the following slides, we will show you how Medicare prescription drug coverage works. So generally, there are 4 steps. So we will begin on step 1, which is the annual deductible. So in this step, the member pays the total cost of drug if it's only at a minimum of $435. And usually at this step, member pays all and plan pays nothing. While on step 2, or the initial coverage, if it is more than $4,020 based on retail cost, member pays part and plan pays part as well. So this includes co-payment and co-insurance. And then for step 3, or the coverage gap, there are 12% of Medicare beneficiaries that reach this step or coverage. So if it's more than $6,350 based on throw-off, member pays most and plan pays a little. They usually pay 25% for both brand name drugs and generic drugs. But the last step is a catastrophic coverage. So only 4% of Medicare beneficiaries reach catastrophic coverage. And the member pays the greater of 5%, or $8.95 for brand name drugs and $3.60 for generic drugs. So premiums. This is the amount of money you spend every month to have access to a health plan. So usually, rates and prices for premium coverage rise every year. But for this year, 2020, the basic premium for the minimum Part D plan has decreased from $33.19 in 2019 to $32.74. Part D National Base Beneficiary Premium. This is a value used to calculate how much you owe in Part D penalties if you sign up late for benefits. The NBBP is set at $32.74 in 2020, a decrease from $33.19 in 2019. Part D income-related Medicare adjustments amount. This is the extra charge from the government for Part D coverage and is usually based on your income. So you will pay monthly to the federal government as well as monthly premiums to the insurance company. So there are two categories. So first is the individual tax return. So if it's less than or equal to 87,000, there will be no surcharge. But if it's greater than $87 and less than or equal to $109,000, the surcharge is 57.80. If it is greater than $109 and less than or equal to $136, surcharge is $144.60. If it is greater than $136,000 and less than or equal to $163,000, the surcharge is $231.40. If it's greater than 163 and less than 500,000, surcharge is $318.10. And if it's greater than or equal to $500,000, the surcharge is $347. For joint tax return, if it is less than or equal to $87,000, there will also be no surcharge. But if it's greater than $87,000 and less than or equal to $109,000, the surcharge is $12.20. If it's greater than $109,000 and less than or equal to $136,000, the surcharge is $31.50. If it is greater than $136 and less than or equal to $163,000, the surcharge is $50.70. If it is greater than $163,000 and less than $500,000, the surcharge is $70. And if it's greater than or equal to $500,000, the surcharge is $76.40. So for more information, you can email us at hello@medicarehelpgroup.com or contact us at 925-732-2845. Medicare Help Group, always at your service. Don't forget to hit like and subscribe for more helpful videos on Medicare.